Welcome back, everybody, to part 2 of this month's, or last month's, Q&A. So, thank you again for everybody who interacted. Keep the questions and the comments coming. Once a month, I answer them, just like we're doing today. And these videos are for education only, as I always say. All right, so let's get right back into this. So, on my Bongo RX and EPAP devices, Michael writes, how can I get a prescription to buy one of these without insurance, or buy one without a prescription? Yeah, it's probably you need a prescription, so you can either talk to your primary care doctor or have a sleep person. I mean, that's the best way. As far as buying them without a prescription, I honestly don't know. I don't know. I mean, I'm sure there's black market ways, but that's not what we're here for. Michael also writes, is snoring harmful for my health? I don't know if I have sleep apnea, but I've been told I snore loudly. Good question. So sleep apnea is what hurts people, right? Airway closes off. That triggers awakenings. That triggers the heart rate going up. Triggers the blood pressure going up. That over time can cause harm. Okay, to the cardiovascular system especially. Snoring is not really thought of as being a dangerous condition, but snoring can be a marker of sleep apnea. Not everybody who has sleep apnea snores. Not everybody who snores has sleep apnea, but it's a good indication. Okay, so if you snore and you wake up tired, if you snore and your sleep is disrupted, if you snore and you just think there may be sleep apnea, it's worth getting tested. Okay, and there's many ways to do that, including a home test. I live alone though, so I don't have reason to address it at the moment if it's not otherwise harmful. Well, like I said, snoring by itself is not, but it could be a marker of something that is. So I would err on the side of getting it looked into. Thank you for that. On my How Do Sleep Problems Affect Society video, Forerunner writes, do you have any experience with patients trying nasal stents to keep their nasal passages open during sleep? Yeah, nasal stents, nasal dilators, I usually reserve those more for snoring. Okay, you can give them a try. Anything over the counter like that, it's not going to hurt you. It may help. So, sure, give it a try. I may have uars and sleep through my mouth and sleep through my mouth. I think it means breathe through my mouth exclusively every night because I get nasal congestion. Sprays and turbinate reduction has not helped, nor has CPAP or oral appliances. Are there any long-term problems with nasal stents? No, I don't think so, especially if you've tried those other things. I'm surprised that nothing else has worked. I'm thinking of buying some from Alaxo. I'm not sure what that is. Also, someone who has slept with mouth breathing their entire life, just to nose breathing. Yeah, typically what happens is, mouth breathing, once it's kind of begun, it tends to continue, What can happen, though, is if somebody is a mouth breather because of nasal congestion, we clear out the nasal congestion and then they put them on CPAP, they actually may reflexively close their mouth, but that doesn't always happen, and that's not the case here. So, I used mouth tape and nasal stents. My brain adapt to nasal breathing over time. It could. Yeah, I would try the nasal stents and see how it goes. But if you haven't had a sleep person take a look at you, I would definitely do so. I mean, sometimes ENTs and pulmonologists and other folks who do sleep, they have different takes on it than a sleep person would. So I would maybe consider having a reevaluation. On my migraines video, Clint writes, what do you think about wearable device claims such as a new Apple Watch that claim to measure things like REM sleep time? I wrote back to Clint, I said I'm pretty skeptical for now at least, and I still stand by that. The way to measure REM sleep, REM sleep, and basically all sleep stages, is you really need to see what the brain is doing. Okay? Now, there are ways to kind of circumvent that and say, okay, if the person is paralyzed or not moving at all, there's a good chance they're in REM sleep. If they're moving a little bit, then they're in lighter sleep. And if they're moving a lot, they're awake. That's kind of how these devices work. Is it perfect? Absolutely not. Can it give you an indication of what's going on? Maybe. Would I rely on that as a physician to help patients? Not at all. What I am curious about is what the patient will tell me subjectively. So if a patient tells me, my Apple Watch says I do this, and I'm wearing Apple Watch right now. If somebody says to me, my Apple Watch says I do this and that, and, it says I'm not sleeping deeply or it says I'm sleeping great, All right, sir or ma'am, what do you say? Well, I feel like I sleep great. Okay, that's really what I care about. Okay, especially if we've done other kinds of evaluations, like a sleep test, for example, and made sure ruled out other dangerous conditions. So, it's there is some utility, but I do not rely on that for like, oh, this person needs more REM sleep or whatever. Okay, because just the technology is not there yet. Good question though. All right. I'll do one more and then I'll end this one. I don't want these to get too long. On my dementia and sleep apnea video, Brendan writes, "Wow, thank you for this. We'll be sharing it." Thank you, Brendan. And then on the same video, Doreen writes, "Great information. Thanks. Welcome. This is definitely a concern of mine since dementia runs in both sides of my family. I have sleep apnea for a while now. I haven't had good quality sleep. I occasionally wear my Fitbit to analyze my sleep, and it's always on short or deep sleep. I'll have to start incorporating your suggestions." Yeah, just like I answered with Clint. I mean, these devices are helpful, but I would not rely on them for anything, okay? What I would say with your case, Doreen, is, if you do have sleep apnea, get it treated, okay? That should be the first thing that you want to do, is get it treated regardless of what the Fitbit says, okay? Then if the Fitbit tells you this or that, then you can kind of, look into that information. But I think the first step is getting the sleep apnea treated, because we know it affects everything. Like I said before, cardiovascular illness, but also now we know risk of dementia as well. So good luck getting that done. Hopefully, at least in the meantime, I would say definitely stay off your back, okay, and try to sleep on your side or an incline, and no alcohol before bed. All right, so I think I'll stop there, and then we'll have one more video starting in a few days. So thanks for everybody who interacted. Until next time, sleep well.